for what's in
Okay.
store.
Okay, asante sana. Asanteni sana jamani, yani tunashukuru kwa kweli. Okay. Welcome to Qhsc online training. This is Dr. Harriet Gabones Yakabe. I am so excited to go to have you guys coming today, and I'm gonna give a little bit of background. So my mentee, Miss Abela, Isabella, so she will know why we are meeting with you guys today. So Miss Abela, I went to high school. So, but they call like an ordinary level and advanced level in Tanzania. The school called the Welwel Secondary School is a girls' schools. So that's why I had my 6 years there for my education before I went to the national service and then come to America. So I'm attached with them. I saw them last year and it was so exciting. So I'm excited for them to be here to come and listen to you. And we had a little conversation behind the scenes saying that you're going to communicating with them, and of course, like almost maongezi ya wasichana. So she wants to go and share what her experience is, and I'm going to give her time to introduce herself. But so this is the school, which is the northeast part of the Tanzania. It's called Moshi. And I am so blessed and so happy and excited to hear you guys communicate and participate in this meeting. And thank you very much for a short notice. Definitely my Rose Temo and Magdalena for allowing us to be able to have this opportunity. So it's a great, great opportunity, and we hope we have more opportunity like this. So without taking too much time, you guys want to say hi before I let Isabella speak? So you can unmute and say hi to Miss Isabella.
Hi, everybody.
Okay, I'm gonna let Miss Isabella say hi to you guys.
Hi, guys. How are you? My name is Isabella. I'm 17 years old. I just had my birthday a few weeks ago. I'm going into my last year of school, senior year of high school, 12th grade. I'm
Ready to,
excited to talk to you guys today.
and I'm trying to convince her to come to Tanzania next year when we come to the medical mission so she can come and visit everybody. So I'm excited. Hopefully we get to convince her. So if you guys ask her questions and get to keep talking to her, and then she might maybe be convinced to come with us. Okay, I'm gonna start the PowerPoint so then she can go and present for us. Yeah. So if you have any questions, on the side of your Zoom, there's a chat. You can post the questions there, and then in between, we'll allow you to ask the questions. Or if you want to write it, even the question in Swahili, that's okay. Write the question in Swahili, and then I can translate it to her, and then she'll be able to answer those questions.
This is my presentation about hygiene and the menstrual cycle, and also I'll be talking about endometriosis. And my name is Isabella Lombardo. So as I said, I'm 17 years old. I'm going into my senior year of high school. I go to Seminole Ridge High School. It's out in Loxahatchee, Florida. I'm a Girl Scout. I've been in Girl Scouts for almost 10 years. And right now I'm working on my Gold Award, which is like the highest like award of in Girl Scouts. Um, I ride horses. I've been riding horses for over 4 years, almost 5 years now. Um, I ride in Wellington, Florida, and yeah, my favorite subject in school is science. I've always loved science. I love all parts of science, chemistry, biology. I love marine science, and yeah.
Do you know what you're gonna be when you grow up?
I have I have two ideas. I don't know which one I want yet. I either want to go into marine biology and just working out in the ocean, or I want to do something related to horses since I've been involved with them for so long. Um, I'm thinking more of like the training side of horses, like whether I'm training the horses or I'm training people to ride horses. Um, but I haven't decided exactly what I want yet.
That is great. Great ambitions. Okay, go for it.
Okay, so starting off, um, also, am I talking at a good pace? Is that good?
Yes, yes.
Okay.
And
So starting off with,
sorry, Isabella. So
it's okay.
the well students, do you guys need the translation or you understand what she's saying? Yeah, great girls. Keep going.
Um,
Go, Isabella.
okay. So starting with the menstrual cycle, so it happens in all girls. Every girl has it. Um, usually girls start from 9 to 16. I think I was 12 when I started mine. I know some girls who started later. I know some girls who started earlier. So your period happens with all girls. So basically what it is your body is releasing blood and tissue from the lining of your uterus. This lining grows, but then your body, if you're not having a baby, your body doesn't need that lining anymore. So it sheds it, which is what the bleeding is. Um, so your menstrual cycle is made up of 4 phases. That is about 28 days. You know, it can vary with some people. So the first thing is your menstrual cycle, which is your period. It's usually between days 1 to 7. Some people have them shorter, some people have them longer, and that's totally normal. The second is your follicular phase, which is days 8 through 13. That's when you feel like more productive. Your body feels more like energetic and you're like ready to do things. Your ovulation is around day 14. This is when your body is feeling like at its high, and this is also when some girls are more likely to get pregnant. The last phase is the luteal phase, which is around days 15 to 28. Um, this is the last 2 weeks before your period, and you're more likely to feel more sluggish and tired. You may be more hungry. Um, and yeah. So, some symptoms of like some side effects when you're on your period, you may feel cramps, you may feel mood changes, your head might hurt and get headaches, you might feel nauseous, and you might just feel overall more tired, which is once again totally normal. Now I want to know, have you guys experienced any of these symptoms like cramps, headaches, nausea? Have you guys experienced any of those? Yeah.
Okay. Okay, so we give you a chance towards the end for you guys to discuss that part. So then, yeah, so good.
Okay, so going on with hygiene and self-care, usually people use most common things that people use are pads, tampons, or period underwear that just collects all the blood, so you know it's not just going away everywhere. Um, so every 4 to 6 hours is when you're going to change, when you're going to want to change or wash your pad. Just to be clean and make sure, you know, no infections or anything. You always want to wash your hands before and after changing your pad or anything. Um, Also, you want to shower daily to keep your body clean and to avoid infection. And you always want to wipe from the front to the back so you don't, once again, no infections.
Did you guys understand that? Okay, so if you have any questions au kama mna maswali, andika kwenye karatasi afu baada ya muda kidogo patakuja kuanza kuuliza hayo maswali. Kama una maswali kuhusu usafi, andika swali hapo chini afu tutakuja kuuliza. Namalizia kama slide 2 zaidi afu tunarudi tena kwenye maswali yenu, okay? Sawa? Okay.
Okay, so endometriosis, what is this? So, Endometriosis Awareness Month is in March. It did pass. Um, and Endometriosis affects about 1 in 10 women. So on the next slide, I will explain what it is. So endometriosis is a disease where the tissue inside of your uterus grows outside of the uterus where it's not supposed to be. This causes very painful periods. It causes excessive bleeding. It also can cause lots of nausea before or during your period. And it also, in some people, it causes infertility, which means you cannot have a baby. This affects 1 in 10 women. Endometriosis affects 1 in 10 women around the world. But thankfully, it can be treated with pain relief, hormone therapy, or surgery. It is not 100% curable yet, but there are ways to tackle the pain and just help you through with everything. So I want to ask you guys some questions. Um, do you think you guys go through a similar experience of like the symptoms of endometriosis, like super, like your stomach hurts so much when you're on your period, or you bleed a lot, or you're nauseous all the time? Does anybody experience things like that?
No. Yes. Yes. Yes.
Okay, I'm hearing some mixed things.
Yes, we're gonna have you guys to discuss in a couple of minutes. Yeah. So okay, so then we know najua kwamba kuna watu wanapata hizo symptoms kama hizo na wengine hawapati, au wengine maybe ziko light, yani hauzisikii maumivu zaidi kama wengine. Kwa sawa, tutakuja kudiscuss hapa in few minutes. Kama baada ya dakika moja tutaanza kuweka mwanze kuongea mmoja mmoja.
I also want to know, because mine does sometimes. Does your period pain or any type of pain relating to the menstrual cycle, does it prevent you from doing like activities you like or going to school? Does it affect you in any way?
Okay,
Yeah.
we're gonna find out what activities that. Good. Okay, last question, and then we're gonna start discussing.
And then I also want to know, because I have some that work for me. Do you guys have any relief measures or anything that help you like get over the pain or help you feel better? Um, yeah, that's good.
Okay, so give them your experience, then we can discuss. Go ahead.
Okay, so my experience with endometriosis, I have always, like from the beginning, I've always experienced very bad period cramps and nausea. And everybody told me this is normal and like you're supposed to feel this way. But it eventually got worse over the years. Um, so it isn't 100% confirmed that I have endometriosis because to be able to determine that, I'd have to go under a procedure, and it's not completely necessary for me to do that yet. Um, but the way that I'm pretty sure I have it, my mom has endometriosis, and it is a genetic disease, so it's passed down um, through generations. So it is very likely that I do have it. Um, I am now on a treatment plan that helps me with the pain, and it's helped me a lot to feel so much better. Um, Although it's not cured, but it does help me feel better. And that helps me. I now understand why I was in so much pain, which helps me deal with it better. Now that I kind of know what's going on inside my body. Yeah.
Okay, thank you very much. So now we're gonna start a discussion, and I'm gonna stop the slide so at least you will be able to see you guys when you answer these questions. And then before I continue, we have other ladies who wants to come and listen to you. Some of them have been in here listening to you and have probably some wisdom, ideas for things to make it better. traditional things to do, or if they have a similar experience, then they'll be able to let you know, so at least you know what is happening. So I'm gonna change my screen to make sure that we can see everybody when you guys are speaking like this. So then, yes, and people who on the audience, our elders, if they can come and share with you in between, that's fine. So we're going to start with the students now. I know she asked the first questions that does anyone go through a similar experience? So kuna mtu ambaye kwa kumsikiliza tu alichosema nani Miss Isabella, kuna mtu ambaye naye anapata hayo maumivu kama hayo anashindwa kufanya activities, anaenda kwenda darasani kufanya michezo, au inabidi unaumwa mpaka inabidi utumie dawa ili uweze kwenda nani hospitali au dispensary there, au kitu ambacho kinakusaidia. So kama kuna mtu ambaye anaweza kutaka kuongea wa kwanza hapo, aje kwenye mic aongee, and you can speak in English if you want to. Yeah, first I'll say, tell us your name and the grade. That's how we look. Okay, go ahead.
Okay, my name is Eunice Takomba. I'm from
Okay.
6 Eka.
Okay.
Yes, I've been going through the same experience since when I was in my form 3. Yeah,
Okay.
Actually, with me cramps, so I don't really know if it's the disease. But then the pain is too much, and I have to take pills for it, for relief.
And how many days do you have your period? How many days unakuwa kwenye hadi? How many days?
Like the pain.
Yeah.
Yeah, the pain goes to about 2 to 3 days.
2 to 3 days. Okay. And the cramps. Okay.
Yeah.
Kwa hiyo unatumia kitu gani kukusaidia kwamba kupunguza hayo maumivu? Dawa gani unazotumia?
Painkillers.
Yeah, what's the names of the medication?
Grufen.
Oh, diclofenac. Okay. So Isabella, diclofenac is kind of like like Midol, Motrin and stuff like that to help with the pain.
Mm-hmm.
Yeah.
Yeah.
That's what she's
Okay.
using. So I mean, you understood what she was saying, right?
Mm-hmm.
Okay,
Yeah.
perfect. Thank you, Cynthia.
Thank you.
Okay, next person. Anybody with another experience? Yeah, afu kama kuna mwingine mjipange karibu ili tu tuna okoa muda. Kama kuna mwingine anataka kuongea baada ya dada hapo, na mwingine aje hapo pembeni. Sogea karibu. Okay.
My name is Lailat.
Laila,
I
okay.
I also face the same problem. The
Okay.
pain starts from day 1 to day 3. But what is so much difficult to me is that it also has vomiting and diarrhea. That's the most. And what I take as my pills is Vivian.
What do you take to help?
Vivian. There's this kind of medicine known as Vivian.
Vivian, okay. I know I asked Dr. She's not here. So okay, we're gonna write it down. Miss sijawahi kusikia. Eti mwalimu, unajua dawa ni Vivian ni dawa gani? Ni kidonge au ni ya kunywa?
Ni kidonge.
Kidonge. Unakunywa siku ngapi?
Until the pains from day 1 to day 3. Every day I take one pill.
Take one. Okay.
In the morning and in the evening.
Okay, so then you 2 pills per day for 3 days.
Yes.
Okay, and then it helps. So is your period, are we bleeding, is it heavy or is just a moderate amount?
It's just a moderate amount.
Okay, and it's how often do you change the pad?
After every maybe 4 hours.
Okay. Okay. So she takes, okay, thank you. What's her name again? Alicia?
Lilas.
Lilas. Okay, thank you, Lilas.
Thank you. What would that medication be equivalent to here, or is there none?
I'm not sure which. She said Vivian. I'm gonna ask. I wanted one of the pharmacists to join us, but she is in the hospital. She's going to join us in a few minutes. When she is, then I can ask. But I've never heard of that part. But there's so many drugs.
Hmm.
But she takes the pills. She takes twice a day. So one in the morning, one in the evening for 3 days.
Yeah.
But also she said she gets vomiting and diarrhea. So sometimes the cramps, for the ladies who are here, if you have experienced something like that when you're period with the cramps, do you guys get diarrhea and vomiting with your periods? Because I know people have suffered with all these heavy periods, cramps and stuff like that.
Hmm.
For any of the ladies, if you can join in. Hey, Sister Veronica.
It started when I was 9,
Wow.
and then it stopped and came back when I was about 11. And then ended my periods when I was in my mid-40s. I started menopause. I've had an entire time of having periods. I had extremely heavy periods with clots,
Oh,
which
wow.
from all the time, just heavy, heavy, heavy. And it would last from 1 to 5 days.
Wow.
I never got diagnosed with endometriosis or anything like that, but I do know that my mother experienced the same thing, which means that it might be hereditary that we have these heavy, heavy, heavy clots of periods. And I was wondering if anybody experienced that, and do they have to stay home when they're having their periods? That's my question. Thank you. And I no longer have it, so I'm celebrating at 70 that I'm
Also
free
good.
of periods.
Yes.
Thank you.
Thank you, Sister Veronica. So just to give you a
Okay.
background, Sister
Yes.
Veronica came with us last year with the medical mission, and she did an excellent job to one of the school, Minazin Primary School. We were talking about the same thing, menstruation, self-care during that time. We don't want you guys to miss the school. So this is the school from another school from the northeast of the country. It's called Iweruweru. This is the school that I went there for boarding school for 6 years. So
Really?
they are at the boarding school. So yes, if they get their period, more likely they'll be staying in the dorm or something like that. Like if it's heavy and painful like that, they will go to like the dispensary or your clinic at this, and then of course the nurse will let them go and rest. Yes.
I hope we can visit. I hope we can visit you young ladies at some time.
I know we are hoping. Yes, we are planning. In fact, there's a beautiful. I can't tell you now.
Thank you.
They're
Thank you.
close
I
to
know.
There's close to Mount Kilimanjaro, and then there's a national park in, Ngorongoro Crater and all this stuff. So it's a nice thing to go over there. Yes.
So if they have any questions about my lifetime experience of having periods, I certainly am willing to answer. Thank you.
Oh, Mwalimu Rosengaiza, that's for Minazini. Wow. Welcome. Unmute yourself. So the school from Minazini Primary School, they join in. So the well girls, while the Minazini is trying to make sure the audio is possible, another person who can come forward to speak.
Let me come forward.
Oh,
and
my
I
sister
apologize about the
Victoria.
background noise. Yeah,
Okay.
good morning, everybody.
Good morning.
So I'd like to approach this subject matter from a different angle and talk about the traumatic side of, the menstrual cycle. I started my menstrual cycle at 12. I still remember the day. It was June 12th, 1975. And it was so traumatic for me because I did not have that prior knowledge and the information and the education and all that because, I grew up back in the day when everything was taboo and you don't talk about such things. And so when it happened, I was just a normal Saturday morning, playing with my siblings and went to the restroom and came back out and oh my God, it was blood everywhere. And I thought I had did something wrong and I was crying and my mom had company at the time and my sister went and got my mom. And it was just a very traumatic experience. So from that point, my mom, kind of explained what was going on. And so, but she didn't tell me it would come back. And so the next month it came back and I was even more traumatized because I just did not know, and they did not teach it in, PE, physical education at the time. And so I think this is a wonderful, thing that you're having this conversation early on with the girls in their teenage years. And yeah, I think the more information you get, the better,
That's true. Okay, so that was Sister Victoria, our Lady Victoria. She has been to Tanzania like 3 times already, and then so we are trying to get her to come again next year. So God willing, if we are able to, we can come to Werwer and you guys will see these ladies. So did you guys understand what Lady Victoria was talking about? Being traumatized, being scared the first time you became you went to your period, right? Did you understand what she says?
We would like to have some translation.
Okay.
We would like translation.
Okay, I'm gonna give you just translate kidogo anachokisema. Anasema kwamba kwa mara ya kwanza alipata damu zilianza kutoka akiwa na miaka 9. Alafu baada ya hapo hakujua kwamba kwa nini damu inatoka. Kwa hiyo akaanza kuwa analia, anaogopa, alafu maumivu kidogo yanakuwepo. Kwa hiyo akaenda kwanza kumuuliza mamake kwamba kwa nini damu inatoka. Alifikiri kwamba amefanya kitu kibaya mpaka damu kuanza kutoka. Unaona? Kwa hiyo hakuwa na information kabla ya kujua kwamba okay, watu wanaenda wasichana wakifika miaka fulani wanaenda kwenye hadhi zao au wanapata period. Hakuwa anajua hivyo. Kwa hiyo ndio maana nasema kwamba kwa mara ya kwanza ilivyo happen akafikiri kwamba kwa nini damu inatoka hivyo nyingi na hajafanya kitu chochote, kwa nini? Kwa hiyo alivyouliza ndio akamwambia kwamba hiyo inatoka kila mwezi, itakuwa inafanya hivyo. Kwa sababu hakuwa anajua, unaanza kuwa una wasiwasi, unaogopa kwa sababu okay, sasa nitajuaje itakuja lini? Kwa sababu hamna mtu anaye kufundisha kama nyinyi mnavyojua kwamba hizo siku za kuja, siku gani una bleed, siku gani ambazo hau bleed na siku gani unakuwa unazunguka tena mpaka tena mwezi ujao. Kwa hiyo hakuwa anajua information, ndio maana akawa ana wasiwasi. Sasa ndio maana akawa anauliza nyie, je, kuna mtu ambaye amepitia kama hivyo, yani kwamba hukujua kama unaweza ukapata period mpaka ikaanza, au kuna mtu aliwafundisha kwamba unajua nini, ikifika miaka fulani period inaweza ikaanza? Mmekuwa mnajua hicho kitu? Kwa hiyo kuna wachache walikuwa wanajua, wachache wakujua. Okay. Na mwalimu Chambo, naona Minazini mmeweza ku unmute. Ongea basi tusikie kidogo.
Na sisi pia huku wanasema na wao kwa naweza kusema
ongea tu Kiswahili tutasikia.
Okay, walikuwa wanajua, wanafundishwa darasani, kuna somo maalum kwa ajili ya wasichana kabla ya kuingia kwenye period. Kwa hiyo wanakuwa wanafahamu kwamba wakifika watakapokuwa kwenye wakati huo basi wajisaidiaje. Huwa wanapewa somo kuanzia darasa la 5, la 6 mpaka la 7.
Okay. So subiri kidogo mwalimu Chambo. Lady Victoria, what they're saying for the well girls, the one on the top with the uniform there you can see, and then from Minazini, mwalimu Chambo just finished speaking. They are all saying that when they get to standard 4, 5 and 6, which is kind of like not middle school, darasa la 4 na miaka mingapi mwalimu Chambo?
Darasa la 4 wanakuwa na miaka 8, 9.
Okay, so the standard 4, which they have like 8 or 9 years old, they start teaching them in school. I mean, the period being, it's going to come and how to prepare for it. And if it happens, these are the things that you need to do. So the same thing, feedback came from the well girls. Some of them, yes, they knew about it. Some of them did not. So it's, hit and miss. So probably depends on who you are living around with. In some school, definitely they have a program like, the one that we know from Minazini. Yeah, standard 4, then they do that 5 and 6. So they teach the girls what is coming, like with the expectation, how to be clean and stuff like that. So, which is good. But, like the more you discuss, the more awareness they get. And then so they understand that is to reduce that traumatization during the period. Yeah, because it's unspoken. And I'm going to ask, go ahead.
Exactly. And we're talking about the 1970s in my day. So that was,
where there was no cell phone. Can you imagine, girls, there was no cell phone that time to Google.
Yeah, they can't even imagine 1975. So.
Yes, it was a long time ago. But yeah, so I'm gonna go back to Lady Veronica when she was saying that a lot of pain, a lot of blood clots, you know, like in mabonge ya damu yanatoka wakati wa ukiwa kwenye mwezini. So hiyo mara nyingi inatokana ni, lakini Isabella is saying if umeona ile picha ya uterus, na hiyo picha kamekaa kananing'inia hivyo alafu na pie shape. Sasa hiyo inaitwa ni uterus. So inside the uterus there's lining, like where you are lining around the inside the uterus, mfuko wa uzazi. So just in case kwamba hakuna sperm au haujatembea na mtu yoyote kwamba uweze kuja kupata pregnancy, ile lining inabidi itoke. So kwa sababu inakuwa ni mara nyingi inakuwa ni nzuri na kwa wanawake wote ambao unakuwa na hormones zako zikifika, unabidi uwe na, yani wanasema reproductive age, wakati ambayo unaweza kupata mimba. Kwa hiyo ikifika hiyo lining, ile lining inakuwa iko tayari kwa kusubiri kama kuna mtoto anaweza akaja akafika pale. Kwa hiyo kama haujafanya kitu chochote kukufanya wewe na mimba, hakuna sperm inayokuja pale, ile lining inabidi itoke. Sasa baada ya 5-6 days ikitoka ile, sasa wengine wanabahati kwamba inatoka bila maumivu. Kwa hiyo kama inabidi kama almost ina peel off. Inatoka hiyo afu cells zina grow again, afu inasubiri mpaka tena mwezi mwingine. Sasa wachache ikitoka inakuwa ina pull too much au inakuwa iko attach kwa nguvu kiasi kwamba ile wakati inatoka inaanza kufanya maumivu, na inafanya maumivu inaongeza damu kutoka. Ikiwa damu inatoka inaanza kuwa damu mabonge baada ya kutoka tu kwa kawaida mtiririko. Kwa hiyo ukifanya hivyo haya inakuwa ni maumivu sana. Ndio maana ukinywa dawa ya maumivu ile inapunguza kwamba usisikie maumivu yapo, lakini maumivu yapo ni kwa sababu tu uyasikii. Lakini kuna vitu vingine ambavyo tutadiscuss kabla tujamaliza, ni vitu ambavyo unaweza ukavifanya bila kutumia dawa, kujaribu kujisaidia mwenyewe kupunguza maumivu, kwa sababu kama inatoka inauma, na kama inauma ni kwa sababu unapoteza damu. Inabidi wewe unajitahidi kunywa maji sana, kwa sababu inabidi mwili bado unahitaji damu izunguke. Ukipoteza damu hivyo nyingi bila kurudisha maji mwilini, utakuwa unajisikia uko weak, utakuwa uko tired. Na kama mmoja hapo, nafikiri Laila, kama sijakosea jina lako, alisema kwamba ikiwa inauma hivyo mpaka unaanza kutapika au unapata yani choo cha haraka, diarrhea, au unaharisha. Ukifanya hivyo vitu ni kwa sababu maumivu yanakuwa makali sana kiasi kama mwili wako unakuwa una mshtuko, unaanza sasa kutapika, kutapika hivi. Sasa unapoteza maji hivi, unapoteza maji ukiharisha. Kwa hivyo vyote hivi vinakufanya wewe unakuwa maji yako imepungua mwilini, yani tunasema dehydration. Kwa hiyo itakufanya pia unakuwa tired zaidi. Sasa hiyo haikusaidii kama uwezi kujitunza vizuri. Na Isabella amemwambia kuhusu infection. Unaosha mikono kabla ya kushika padi kwenda kubadilisha, na ukimaliza unaosha tena mikono ili usipate kupata infection, kwa sababu kama umeisha kuwa huna maji ya kutosha, dehydration, alafu sasa unashika na uchafu, utaugua. Na ukiugua sasa unakosa madarasa, alafu sasa of course wenzako wanaendelea kusoma kama kawaida. Kwa hiyo ni vitu vingi sana vinaendelea mwilini hapo wakati unapata hiyo uko mwezini hizo siku chache. Na kama alivyokuwa anaelezea, kuna siku 28 ya mzunguko au siku 35, alafu wengine wanakuwa mpaka siku 40, ambao mwezi unakuwa kila baada ya wakati mwingine mwezi mmoja unapata period mara 2, which inaumiza zaidi tena. Kwa hiyo inabidi ujijue mwenyewe. Mnaelewa kile ninavyosema? Okay. So I was just giving them the background of why the the periods or the bleeding can be heavy to some people, or it can be less heavy or painful to some people. So the lining of the uterus usually is supposed to be lining up for normal growth, cell growth, lining up in preparation of the pregnancy. So if you did not do any sexual intercourse or don't have any sperm go to join with your ovary, so then there's no egg, there's no conception, so there's no pregnancy. So if there's no pregnancy after those the first 7 days, it's just gonna peel off. So the peeling part, that's what the cramps start hurting. So some people are lucky, it just peels slowly, and then so there's less pain. Some people are not lucky, it peels and it causes so much pain that by that just separation, and then cause more bleeding. So that's the part that heavy bleeding comes in. You get those clots, blood clots. So those blood clots makes you even hurt because remember that area is irritated already. It wants to peel off, and of course the blood touches the empty spots. It's going to be more irritation. You get cramps. You feel like almost feverish because your body is overworked. So when you're doing those things, you have to take care of yourself. And that's why I said I included the infection part, hand washing before you touch yourself and after you're touching yourself, because you don't want to touch blood all over the place. And then dehydration is always the bigger thing that makes people weak. Because if you're losing blood so much and you're not replenishing with anything, you're going to get tired, you're going to faint if you're not careful. And that's why I encourage them when you're on your menses time, drink a lot of fluids. Some people say drink tea or hot tea or whatever thing. But anyway, hot tea also will help because your body is like this, irritated. So when you drink something nice and warm, it's going to relax those irritated tissues and then you get some relief. Some people get chupa ya maji ya moto and then unasigina kwenye tumbo pale area. Sijui kama kuna mtu amesha kujaribisha hiyo. Mimi nilifanya hicho nikiwa mdogo. Tupeka chupa ya maji ya moto and then unakanda tumbo pale, inasaidia kwa sababu ile warmth, au unachukua tu towel ya moto ya maji ya moto unagusa pale ile muscles ambayo iko irritated ina relax. So those are things that you can do bila dawa. Lakini kama unahitaji dawa kweli meza dawa kwa sababu ni maumivu makali. Na kama kweli unaweza ukaenda kuchekiwa hospitalini, hiyo ni vizuri ili waweze kujua tatizo ni nini. Hapo nimeeleweka? Yeah. Okay, mtu mwingine najua mwalimu Chambo ulikuwa unaendelea kuongea, kama una feedback kutoka hapo Minazini.
Kwa watoto hapa ambao wamesha kuwa katika hedhi ni wachache kwa sababu huku kwetu wanaoanza period wanakuaga kuanzia miaka 13, 14. Kwa hiyo mara chache utawakuta wadogo hawa wameingia kwenye hedhi. Na baadhi yao walioingia kwenye hedhi wanasema kwamba wengi hawana maumivu ya tumbo. Wachache ndio wanapata maumivu. Na wale ambao wanapata maumivu mara nyingi wanatumia Panadol.
Panadol, okay.
Ili kupoza maumivu ya tumbo.
Okay, so let me translate to Miss Isabella. Okay, Miss Isabella and all our ladies there. So, Mwalimu Chambo from Minazini, she's saying that the girls at the school, majority of them start their period when they're 13 to 14 years old. And then so also majority of them don't have as much pain as the rest of us. So they're lucky and they're young. Good for you. So they have less pain and then they started when 13, 14. So it's very rare to have the 9-year-old or 10 years old. But that's also mostly evidence-based that the girls always start, some of the girls start very early, 9 years old. At least as of now, it's written. I'm sure probably there might be somewhere who start at 8, which is, I feel bad because once it starts, it's going to go all the way until you get to menopause. But yes, so they used Panadol. So that's one of the pill. It's a Panadol. The same thing like Mido, Motrin, stuff, that breakdown like that. So it's always for the painkillers. So it helps for the pain. Anybody's mtu yote ambaye anatumia kitu ambacho sio dawa, kitu chochote ambacho kinakusaidia kupunguza maumivu. Anyone who is using anything else other than the medication, like traditional things at home, maybe your mom, your aunt, your grandparents told you how to do that to help with the pain. Any suggestions? Yes. Okay, come here. Maybe 2 or 3 people come to the screen so we can hear. Wawili watatu mje hapo karibu kwenye nani, ongea. Sogea karibu kidogo. Okay, ongea. No, jina lako?
Hi, my name is Agnelia James.
Okay.
I don't use pills as much, but I was told to do yoga and it has helped me a lot.
Okay, do you know how yoga works?
Yeah, we were taught in the school that I came from. Yeah.
Okay. Do you know how it helps you to reduce the pain? Do you know how it helps you to reduce the pain?
I was never told why. I just did it and it just helped. And I never bothered to ask.
Okay. That's okay. Do you know how, I mean, what style or what move can you show us?
I can't do it in a skirt.
No, describe.
You lie on your stomach.
Okay.
Yes. Then you hold your toes. Like on your back.
Back.
Then you swing up. Then you swing up and down.
Okay.
Yeah.
No, that's very good. So, I mean, just by listening, it tells me that at least you are stretching that muscle. Remember, I said the muscle is irritated. So if you stretch it, it's going to feel a little bit better because it's always irritated and try to shrink it. So when you stretch it, it helps, and if you're doing back and forth, it means you're increasing the temperature that muscle is working. So that means you can put even a warm towel. It will help the same with the yoga. So if you're doing yoga, good for you. Anybody else use yoga to help? Anybody else?
Yeah.
Okay.
Yes.
Minazini mnatumia yoga? Na mtu amesha kufanya yoga?
Hapana. Hapana, nadhani huko hatuna utamaduni wa yoga.
Okay, mnafanya nini kupunguza maumivu?
Wanakunywa maji ya moto.
Okay.
Au wanaweka kitu cha moto kwenye tumbo.
Okay, so for Minazini, yeah, they're not using yoga, but they do, like if somebody is drinking hot water. And that's what I said, some people swear, like, oh, if I drink hot tea, it's going to help us to do. That means you're trying to increase the body temperature to try and relax the irritated muscle so it can stretch and relax, so to get the relief. Or they are using a warm towel on an actual site of where it hurts. So the same thing that, yeah, put a bottle of hot water. That's what I said. When I grew up, that's what we did. We put a hot water, just a little bit above warm water. And then because now the glass bottle gets hot, and then you just massage right then and there, it helps. But which is the same concept with the yoga. If you're stretching yourself back to make sure that your abdominal muscles are stretching, it helps. Because remember, as I said, it's irritated, it's trying to constrict. So if you relax it, you're going to get some relief. For our ladies, any other suggestions you guys have to help the students?
My grandmother used to massage my stomach, like massage my lower abdomen.
Okay.
I know when my cycle would start, I would start cramping at least 2 to 3 days prior to.
Okay.
And it was just a miserable time of the month for me. I had a very, very heavy flow. And my grandmother, she wouldn't give me medicine, but she would make me some kind of, it was called a tea, catnip tea or something like that.
Mm-hmm.
And she would, have me drink it just at the beginning of the menstrual cycle. And then probably the third day, the pain would, let up or ease up. And then, maybe that fourth day, the pain would subside. But practically every day of my cycle, it was tremendous pain. And I just dreaded that time of the month. And of course, I would get nauseous and stuff like that. But just, I guess, even into my adulthood, it just went on and on and on. Even after I had children, it went on and on and on with the pain, with the, just the heaviness and all that. But I would say that massaging helps. And then to not consume sugar, because I noticed if I would drink sugary drinks, that would make my flow much more heavier and then also much more painful.
Oh, wow. You guys understand, Lady V, what she was talking about? I can't hear. Mmesemaje?
Translation.
No, she was saying, anasema kwamba naye pia atumiayo hati, bibi yake alikuwa anamtengenezea hati, alikuwa hampi dawa, akiwa anampa hati tea anywe, alafu pia alikuwa na masaji, yani kama vile pale panapouma unaenda una masaji kama vile unajua kama vile unakanda ili panze ile tissue ziwe laini ili iweze damu iweze kutoka kwa urahisi, lakini maumivu yanapungua. Na hiyo pia amekuwa akifanya hivyo for a long time, na yeye anasema akiwa mwezini damu inatoka nyingi sana na maumivu ni makali sana, mpaka saizi imeacha kwa sababu ni mtu mzima sasa hivi. Sawa.
Yes.
Okay, Miss Liliana and Lady Rukia, if you guys have any suggestions for our girls.
Yes, good morning, Grand Rising, everyone.
Grand
This is
Rising.
Rukia.
Hi.
How are you all?
I'm good.
I started my cycle when I was 9, like Veronica, and it was a little scary also because it happened in school,
Oh, wow.
and yeah, and my mother had just told me just put a bunch of tissue, until I got home. So I did that.
Hold on a second,
But
Rukia. I'm going to be translating so they don't miss the story. I'm going to translate it so they don't miss the story. Yes.
Okay.
Okay. So mmemwelewa alichokuwa nakisema? Jibu, mmeelewa mmeelewa? Okay. Okay, sikia basi. Anasema kwamba na yeye ameanza kwenda mwezini akiwa na miaka 9. Unaona? Na yeye pia hivyo inakuwa yanaumiza hivyo, mimi napata maumivu kama mwingine ambaye amemtaja Lady Veronica aliyetangulia, dada alikuwa mama alikuwa wa kwanza kule aliyokuwa anaongea. Kwa hiyo anasema kwamba maumivu yanakuwepo hivyo, na alivyoanza siku ya kwanza alianza akiwa shuleni. Sasa imagine kwamba kumbuka kama hukujua kwamba itakuja kuanza afu inaanza shuleni na uniform zako. Yani hiyo imagine hivyo itakavyokuwa yani. Okay, continue.
Yeah, and I was going to also add that like Veronica, Victoria was saying not to eat sugar. That might, now that I think about it, might have contributed to some of the cramps that I had because I had a crazy urge, what you call it, for eating sweets during that time, a cravings for sweets, and I had lots of cramps and developed different things throughout my cycle years.
Okay.
I also wanted to add that my granddaughter, she started her cycle, I think like 14, 15, and she's now 18, and twice she has had her cycle for over 40 days.
Okay,
And
niwaambie kwanza, hold on a second, let me tell them. So then Rukia is saying that she started cycle when, as I said, at 9 years old, and then also when she's drinking when she akiwa mwezini alikuwa anakula vitu vya sukari sana kwa sababu alikuwa na hamu sana vitu vya sukari mwezini. Sasa lakini alivyokuwa akila vitu vya sukari, yani ndio damu inatoka nyingi zaidi. Sasa mara nyingi zaidi wanasema kwamba ukiwa uko umwezini usile vitu vya sukari, kwa sababu sukari inaendelea kuongeza tena kufanya damu itoke zaidi, au ndio inafanya tumbo linakuwa linahangaika, ni irritated, ndio unaongeza sasa damu inaendelea kubidi zaidi. Na yeye pia anasema mtoto wake naye anatoka damu hivyo hivyo, na akitoka damu wakati mwingine anatoka damu kwa mwezi mzima, yani siku 40, yani mfululizo. Sasa unaweza kaimagine kwamba jinsi ambavyo unakuwa na maumivu siku 3 4 hizo ambazo unakwazo, lakini kuna mtu damu inatoka almost siku 40. Hiyo ni nyingi sana. Okay, continue.
Yeah, she ended up in the hospital with dehydration from the first time.
Oh,
and
wow.
then the second time it happened, they still haven't determined because she's shy about allowing the GYN to examine her. So I'm constantly encouraging her to allow that, but she's shy about it. And I'm gonna get her to that point that they put her on these pills. It's sort of like a birth control
Birth control
pill.
pills.
Yeah, and now she's not having a cycle.
Yes. Okay,
And
so
I'm not comfortable with it, but these pills, you take them every day.
yes.
So I'm just concerned about that. But yeah, I just wanted to bring that to mention that, even at her young age, she's having these abnormal cycles. And we
Anachosema
still trying to
ni
find out.
kwamba huyo mtoto ni kwamba anatoka damu nyingi sana kwa siku zo nyingi mpaka anakuwa Nakumbuka tukazungumza dehydration, yani unapoteza maji mwilini sana mpaka unakuwa mdhoofu. No. Sasa kama ukweli kabisa kama siku 3-4 hizo unatoka damu afu unakuwa yani unakuwa umechoka. Imagine kwamba unakuwa na hizo siku 40 mfululizo. Na hiyo sasa kwa sababu anakuwa anapoteza damu nyingi, anakuwa yuko dehydrated. Kwa hiyo mpaka akaenda hospitali kwa kulazwa kwa ajili ya hicho kitu, unaona. Na ndio maana anasema kwamba sasa hivi anajaribu kumshauri aende kwa daktari ili aweze kupata diagnosis, yani kwamba waone kwamba ni kitu gani ambacho kinamfanya hivyo aende, ana bleed sana na yeye anaogopa. Lakini sasa hivi anasema kwamba daktari alimpa vidonge vya kuzuia mimba, birth control pills. Sasa hivyo vidonge mara nyingi vinaweza vikafanya wanasema nini, kuregulate hormones ili kupunguza hiyo bleeding. Tatizo lake pia kwamba ina regulate to a point kwamba unaweza usipate period kabisa. Mtu sana anafikiri kwamba siwezi kupata mimba. No, inabidi umeze hivyo vidonge every single day, kuna ni kuzuia, kuregulate hormones ili usibleed sana. Lakini sasa mara nyingi sana watoto wakipata hivyo vidonge vinawazuia kupata ina hold, ina change hormones hizo kiasi kwamba hata usipate period yako. Unaweza kaenda 6 months bila kupata period. Kuna advantages zake, kuna faida zake na kuna hasara yake ya kufanya vitu kama hivyo. Lakini sasa kama una maumivu kiasi cha siku 40, kumeza vidonge kama hicho cha kuzuia mimba kinacho regulate hormones.
My daughter, you gotta get up and go to camp.
So I'm gonna go back to Rukia, that yes, sometimes when the period is heavy, especially if she's bleeding for 40 days, more likely they will find some intervention. Sometimes the people have their diagnosis of endometriosis and then they get a treatment which they can go to the doctor and they do a DNC and try to clean them up and try to make sure the lining is forming accurately. And that's why usually there's more interventions to that. If you don't want those procedures, then they will give them the birth control pills. They give them the birth control pills not because of the prevention of pregnancy, it's because it goes and regulates the hormones that make us go through the menstrual cycle. So if your estrogen is too much or the progesterone is too little to hold that lining very well, the problem comes that when it starts separating, the pain is severe. And some people, it's 3 days, some people 7 days. And now we know some people are 40 days, which is crazy because you're losing so much blood. Chances is going to end up being admitted in the hospital to get help because that's too much. But yeah, so they will get those birth control pills. Unfortunately, you have to take almost every day. It depends on which one they give, but most of the time it's estrogen based to try and regulate the hormones to make sure that their period, either they come routinely, usually it's less and less, and some people don't get it at all. And then so some people usually worry about that, but because eventually if you want to get pregnant, then if you're lucky, if your body and your history is, you have so much estrogen and progesterone, you might get pregnant in the future. Sure. Sometimes you have to stop the medication, and then sometimes the period comes back, so the ovulation process comes back, so for you to get pregnant. So, but you have to weigh which it is, because bleeding for 40 days, that's too much. And then getting the medication, I'm sure she's enjoying that relief, but you still have that you have to take the pills every day. The common challenge that the people have who take birth control pills is the weight gain. So sometimes you start gaining more weight because you can't control. Because since the medication regulates the hormones, also there are a lot of hormones that is supposed to help us in our body. Then some of them are restricted, so they cannot control, and the weight gaining becomes a side effect. So it's something that you have to worry about, being on the period for 40 days or gaining 5 pounds or whatever.
Let me ask another question. How, because I'm listening to Isabella, she's saying that endometriosis runs in her family and she might herself have it, but she's did you say you too young to get diagnosed? Or if that's the answer, then what's the age that you can be checked and diagnosed for it?
So with my mom, she didn't know that she had it before, but then she was trying for a baby and she couldn't get pregnant. So then they went to whatever she went to, and then they were like, we think you may have endometriosis. So then the thing is, to figure out if you have it, you have to go through this procedure that I'm not exactly sure what they do, but they kind of resolve it for a little bit. So usually, I mean, they don't, because I talked to my
OBGYN?
gynecologist. Yeah, they they do not suggest getting that surgery when you're young. They suggest getting it if you're trying to have a baby or if you're older and just like the pain is too much because they're like they don't want to give you the surgery just to see if you have it. They want to give you the surgery to see if you have it and then try to like fix it or whatever. Um,
I got that. Thank you.
so yeah, you're welcome.
And then so to add out kwa wanafunzi wanachozungumzia ni kwamba walikuwa wanamuuliza Isabella kwamba je, yeye kwa sababu wanasema mama yake ana endometriosis, hiyo diagnosis tulikuwa tunaongelea, na kwa sababu kama mama alikuwa nayo na yeye anafikiri anaweza kawa nayo. Sasa kama anafikiri anaweza kawa nayo ni kwamba je, ina runs kwenye, yani kwenye nyie mjiulize kwamba je, dada, mama au shangazi, bibi, je wanayo wanapata hayo matatizo au symptoms kama mlizonazo hizo, unayopata cramps na stuff, kama familia yenu wote mnafanya, so that means hiyo endometriosis inaweza kawa kwenye familia. Ndio maana wanazungumzia kwamba kama mama anayo, chances is na nyie kama wewe ni mtoto wa mama huyo na unapata nani hizo period au hedhi yako ni heavy, then yes, unaweza kawa kwenye familia ipo. Kama nyie mmesha ambia ambao mna matatizo yani maumivu ya rasmi, mmeshaona ndugu zenu pia wote wana matatizo kama ya kwenu, au ni nyie tu peke yenu kwenye familia? Kwa wanafunzi wa Weruweru. Mnaenda some yes, some no. Yes. So kwa hiyo kama umeona mama maybe anaweza kawa nayo, dada anaweza kawa nayo, maybe shangazi anayo. Kwa hiyo mnajua kabisa kwamba hicho ni kitu kiko kwenye familia. Na sababu ya kufanya mkutano huu wa leo ni kwamba kama unajua vitu kama hivyo, mnaweza mkafuatilia kwamba nenda maybe kama maumivu yanakuwa yanauma kiasi kwamba huwezi kuyavumilia, unajaribisha dawa hazisaidii, unajaribisha hiyo vingine havisaidii, then maybe inabidi uende hospitali wakakucheki kuangalia. Na kama anavyosema kwamba mara nyingi inakuwa tatizo unavyokuja sasa kutaka kuwa mjamzito na ni kuwa yani kupata mimba, sasa maybe umeolewa au ni wakati wako kupata mtoto. Hapo ndo tatizo kwamba kama nani ndani ya mfuko wa uzazi kuna tatizo, itakuwa ni ngumu sana kwa wewe kushika mimba, unaona. Kwa hiyo unakuta mtu mwingine baba ameolewa hivi au ana mme au ana rafiki, lakini hawezi kupata ujauzito, ni kwa sababu ile lining ambayo inatakiwa ishike mimba ije mimba ianze kukulia pale ndani ya mfuko wa uzazi, hiyo lining ina tatizo. Kwa hiyo lazima waanze kufanya surgery, na surgery inaweza kawa ni kwenda kusafisha, yani kama vile wanavyosugua vile sakafu wanasafisha, wanatoa zile cells ambazo zimeota pale hazitakiwi, alafu sasa ile wana hope kwamba cell ambazo ziko clean zinakuja ku line up ili ndio aweze sasa mtu kuja kuwa na mjamzito. Wanakuwa wanampa na dawa za kusaidia kufanya kitu kama hicho. So what I was explaining to them was that in order for them to have like they need to be checked off for the endometriosis also. If sister, mom, auntie, grandma, whatever have similar symptoms like what they have, or they have a heavy period or concern during their menses, so they need to go and find out to see if that conversation is there. So if they do have that, so for them to be more aware and then ask for help or seek help. Of course, they try those local remedies to try and help. And then if medication are needed, definitely. If the medication does not work, then you need to follow up with the doctor to make sure that they check them and make sure everything is okay with them. Mwalimu guys, Mwalimu Chambo, una kitu chochote cha kuongezea?
Natumaini watoto wameelewa vizuri. Nashukuru kwa darasa zuri sana.
Okay. Okay, so she's saying thank you. The students are learning a lot of things today. That's good. Liliana, do you want to say anything? You're quiet there. Any experience if you want to share? If you don't, that's okay. Lily, are you there?
Yeah, I am. Sorry, I was driving.
Oh, that's okay. That's okay. Any comment? Lily is one of my students in FAU. So
Um, yeah, I'd say just movement helps me, really. Just light movement. That just helps get those good hormones, those endorphins going, and it helps with the pain a little bit.
Okay.
But honestly, when I get my period, I'm just super sleepy. I
Yes.
sleep a lot. It's bad, but I need it.
But yes, so just from kwa symptoms zake nyewe wanani watu wa mmemwelewa anachosema na watu wa Minazini mmeelewa anachokisema?
Hawajaelewa.
Anasema kwamba yeye akipata nani akiwa mwezini inabidi anakuwa na usingizi sana, yani anakuwa amechoka kila sana, na anachotaka tu analala ili apumzike, kwa sababu maumivu yanakuwa ni makali, unaona. So hiyo inatokana kama tunavyosema, unapata damu inavyotoka sana unashindwa, yani mwili nao unakuwa umepungukiwa damu, umepungukiwa maji mwilini, kwa hiyo unakuwa umechoka kwa sababu huwezi kufanya kazi kwa sababu umeishiwa nguvu. Ndio maana nilikuwa nawaambia kwamba ukiwa kwenye mwezi lazima jitahidi kunywa maji sana, na anasema kama unaweza kupata chai ya moto, sio usiweke sukari, kwa sababu tumeshasema kwamba ukiweka sukari maumivu yanakuwa makali zaidi, kwa sababu sukari inaenda kukufanya nani, ile tumbo liendelee kuwa na maumivu zaidi, yani inakuwa irritated zaidi, unakuwa nani, damu inatoka nyingi zaidi. Kwa hiyo kama unakunywa chai, kunywa chai bila sukari, kwa sababu tunataka ile nani, warmth, ile temperature, ile joto lile liende kusaidia ku relax muscles zako ili uweze kupunguza maumivu, unaona. Kwa hiyo lakini yeye anasema kama anakuwa amechoka sana, inabidi tu alale muda wote huo wakati ana period. Sasa lakini kama una madarasa huwezi kulala tu muda wote, inabidi ujitahidi kwenda ndani darasani. Lakini ukijishughulikia hivyo inasaidia. Okay, kama mna maswali mengine au nini, mnaomba waweze mkaandika mkampa mwalimu, maana muda tumeshafikisha saa nzima tayari. Wape walimu afu tuendelea nani kudiscuss. Afu kama mnaweza mkajibu tena maswali, sasa hizi mmeshajifunza, jibu hayo maswali ambayo tulikuwa nimewatumia. Najua mlijibu kabla hamjajifunza, sasa hizi mmeshajifunza, jibu tena afu mwalimu naomba unitumie hayo majibu tena ili tuweze kucompare. Tukisha soma na tukajibu nani tukajua ni nini, afu tutawaletea majibu yake, na hii tulio nani rekodi sasa hizi tutairekodi tuwape nani link, afu ili muweze kusikiliza tena, au muweze kama mna watu ambao mnataka wao wasikilize pia ili waweze kushare.
Sawa.
Yeah. Any final advice from our ladies, elders, please?
If I could say anything to the young girls, first of all, I want to commend Isabella for taking on this topic. And then also, if I could say anything to the young girls, I would say keep a monthly calendar and, document your heavy flow days and document your pain. All that is important when you do run into a problem where you have to go to a doctor and they ask you questions. At least you have, something to, some kind of guideline to like share your information or your experience with to the doctors. So I think that's one important piece.
Okay, anachosema ni kwamba sasa hivi shauri ni kwamba uwe na kikaratasi au kalenda, alafu uwe unaandika chini siku gani unaanza nani, unaenda mwezini, siku gani umemaliza mwezini, alafu yani unaangalia kwamba je, yani damu inavyotoka inatoka nyingi sana, siku ambayo damu zinatoka nyingi sana, au siku kuna mabonge ya damu. Andika hivi, yani uwe na nani na historia, yani kwamba unapata lini siku zako zinakuwa siku ngapi katika mwezi, alafu tena mwezi ujao inakuja siku gani, siku ambayo matatizo yanakuwa nani yanaendelea kuwa magumu au maumivu yanakuwa makali, then una at least historia kwamba period zako zinakuwa ni siku ngapi, kwa sababu daktari, ukienda kwa daktari kumuuliza, atakuuliza period zako zikoje, lini zimekuwa ni, au ni siku gani una bleed sana, una bleed sana mwanzoni, una bleed sana mwishoni, je una bleed kila mwezi au kila mwezi wa pili, yani vitu kama hivyo inabidi uwe navyo. Kwa hiyo uwe na karatasi kakalenda kadogo, unaandika tu period imeanza tarehe 2, imeisha sijui tarehe 7 au tarehe 6, alafu tarehe 5 na 6 ndio bleeding ilikuwa nyingi. Kwa hiyo andika tu, tengeneza historia vizuri, alafu unapata maelezo kwamba okay, ni hivyo, kama damu imezidi imetoka nyingi hizi siku mbili, nilifanya kitu gani? Nilikuwa kitu cha sukari. Then unaanza kupunguza vitu ambavyo vinaweza vikakusaidia kwamba maumivu yasiwe makali sana. Alafu unakunywa maji. Nikinywa maji, okay, hizi siku mbili nilikunywa maji vizuri, okay, nimekuwa niko na nguvu kawaida, nikaweza kwenda darasani, sikushindwa kwenda kufanya kitu chochote darasani. Unaona? Kwa hiyo ukifanya kitu kama hicho, hiyo inakusaidia kuwa na wewe na historia yako. Wakati mwingine tukifanya tena mkutano, tutakuja kujaribusha kuleta madaktari hivi at least wawili wa Tanzania na huku Marekani, kuwaelezea vitu ambavyo mnaweza kufanya. Maybe ukisema okay, mimi nimebleed kwa siku 6 7, na anaweza kukuambia kama maybe vitu kama hicho, nenda kamuone daktari, ulizie hiki na hiki, ili tuweze kueleweshana. Kwa sababu sasa hizi huwezi kujua, nikisema mara mwisho umebleed lini, kwa siku ngapi, ilikuwa ni nzito au ilikuwa ni laini, unaweza usiwe nayo hiyo information sasa, lakini tutashindwa kukusaidia kwamba tukusaidieje kwa wakati mwingine. Hapo umenielewa? So Lady V, I just told them yes, to keep the calendar and then note the date when they start, when they end, when if it's heavy or it's light, did they drink a lot of water, how did they feel, did they eat anything with sugar, did they feel any difference? So kind of like understanding their body, to be able to train them to make sure that how to lessen the pain without all these interventions. And then also, if needed, then they should take those medication if needed. But something like that, so they can regulate whatever they need to do. But if worst case scenario, then if they need help, at least they have a history to take to the doctors. And also, we're going to try to do another meeting once we get this, their response before and after meeting. We make the video, and then I'm going to try to find a doctor here in the US and a doctor in Tanzania who specifically deals with endometriosis for the girls. And then so we can let them come in here and offer the medical advice in a sense, or medical consultation in a sense, that's just to inform them. If you have these things, more likely you need to go be seen, so you can be checked off. Maybe it might be something worth exploring. And then if we have this and this, maybe they can reduce this to give them ideas to make themselves feel better. And that's what we're gonna do that part. And also, Isabella, I asked them to complete the survey again. And then they're gonna teach me, send it to me once they finish. I did send you the pre-test. I know majority of them were in English, and then some of them were in Swahili, which is fine. We can translate and we get the data. And then we send back the link with the information, so then it will be something helpful for them to understand it before and after, and give the analysis hopefully what they gain. And then in future, in the next meeting, then we will have kind of other people who will help with the consultation, the doctors for both from Tanzania and the US, to see if they can help the girls to know more about their bodies, something that they need to understand to take care of themselves and lessen this much pain. Because yes, everybody, I mean, reproductive age is here. So you are going to get your period. We can't stop that. And you don't want to stop that, because that's a normal way of cleaning up your uterus. Because eventually you might want to have a baby in future. So we want to make sure your uterus is healthy. And then, of course, for now, we want to make sure you don't have that much pain, because having that much pain is not fun. So you can explore your schools and stuff like that and be productive people in life. Okay? Yeah, so kama mna maswali, naomba basi muwape walimu, afu tutayangalia next time with another meeting. But yeah, we're going to suggest another date. So this is good. So anything else, anything you want to say, last, Isabella, then we can be done.
Contacts.
I don't think so. I just want to say thank you so much, guys, for listening.
You're welcome. Well, girls, did you guys want to say something?
Yes. Contacts.
Oh, contact.
And
Okay.
and emails.
Oh, contact with Isabella. Okay, I will send the contact to you said you want to contact you for the Isabella, you want to contact you for me?
Right now.
Okay, my number is, come an international number is 513, yani namba yangu ni 513 728 9756.
The last
So
digit.
it's 513 728 9756.
Your email.
So the the email, I will give it to your teacher. So you can put Dr. Gabone. Yeah, Dr. Gabone Qhsc at gmail.com. And you guys have WhatsApp?
At home. Until December.
Until December, okay, so that's fine. And then so I will talk to Isabella first, and then we'll give her information. So if you have any question right now with Isabella, you can give it to me, then I will forward it to her. Okay. Yeah, Mwalimu Chambo, you have my number, so you can share with the students if they have any question. But also, definitely, if you have any question right now, you can send it to the teacher, and then we communicate very well with the teachers. It will be so easy to communicate with the teachers. And then, yes, if you have something specific, you want to say something, then ask your teacher, then we can communicate without any problem. I don't mind having that conversation if possible. And then if we have information you want to talk to Isabella, then let me know, then I can connect you with her that way. But I have to ask you for her permission and her parents' permission to do that. Okay, everybody? So I think this is good. Yes, if
Thank you.
Yes, if the teachers, can you give me the names of the people who came to the training? So we want to give you them the little certificate that they attended this training. So this is separate from the study, because we just need to give them a notification that they attended this training. Okay?
Okay.
Okay. Thank you, guys.
Thank you so much, Elaine. It was great meeting you. Bye.
Bye, guys. Yes. Bye, guys.
Thank you, everybody.
Bye.
2024